As we do each week, we will begin with the Berks County COVID-19 data report along with the Co-County Wellness biweekly update. And that is being presented by Brian Gottschall, our director of the Berks County Department of Emergency Services and the lead on the Berks County COVID-19 leadership team. Brian Gottschall.
Good morning, Commissioners. Yes, we unfortunately started our third year of file storage on our server for these COVID data reviews as we go into 2022. Of course, the big news is our case volume here. I think that folks would have to be under a rock if they're not hearing about that. Our case count is dramatically through the roof, very much due to the high transmissibility and spread of Omicron, but based on anecdotal data and discussions with our medical community, it also appears that there's a significant amount of Delta in the community that's being dealt with based on the severity of the illnesses. We of course rely on the genomic testing information that's made available in an aggregated fashion from the state and federal government to understand where we're at. And understanding that in the week between Christmas and New Year's, they originally spoke about a 70% prevalence of Omicron and then downscaled that to somewhere just above 30, but still a very rapid spread of that new variant in our area of the nation. We are really no different than the rest of the nation. Looking at our changes by a county level, we can see that we had an 11% increase in the number of counties designated as high spread and commensurate decreases in substantial, moderate, and low throughout the nation, with just very few numbers of less populated counties still being able to claim the rights of those lower levels of community spread. Pediatric cases, a little bit of a bounce up over the last week. We are hearing again anecdotally from our healthcare partners about more sick kids than we have seen in other scenarios, whether it was with Delta or the original novel coronavirus or the beta variant that affected us much less dramatically here in the United States. But definitely more of an impact to kids than we've seen previously. I do want to emphasize again that the child impact in number of cases that we're seeing is not dramatically different by percentage than the large percent increase in cases that we saw. So said simply, if cases are up dramatically in the community, you would expect that cases among kids would also be dramatically up in the community. But we don't want to lose sight of the fact that we are seeing more sick kids with this particular variant than we had previously. Our hospital numbers are once again up with respect to total impacts. We want to point out all the important information, and it is worthy of noting here as we look at these percentages at the bottom of the columns that we do see some higher numbers of vaccinated persons being the total amount in the hospitals as well as in the ICUs and on ventilators. Again, I've had people point out to me in Israel how they have these dramatic numbers of vaccinated people in the hospital. Well, in Israel, they're almost 100% vaccinated. So, of course, you're going to see much larger numbers of vaccinated people by percentage. But again, very concerning. We had all hoped that the vaccine was going to be the panacea. We now understand that that's not the case, and it's really about being vaccinated at an individual level to give you the highest level of protection that you can have as a person, more so than to significantly impact the spread of the disease. Our influenza numbers are up a little bit more sharply than they were the week prior. We saw a little bit of a shallowing of that curve in the week prior. In this last week, the curve between the last two dots to the right of this year's numbers, we do see rising a little bit more sharply. Again, we have to keep an eye on this. We've heard of Fluvid now, and in having discussions with our local physicians, we know for sure that St. Joe's has seen at least one example of an individual infected by both COVID and influenza at the same time. And that, of course, is an important thing for individuals like that because they have the risks of both diseases simultaneously. So, we've got to look at this flu thing as both a total impact on our community simultaneous with COVID, as well as the impacts to individuals themselves who we know can be impacted by both diseases simultaneously. And this really does put to rest the assertions of people who've claimed that we stopped looking for flu last year. Not the case. People were getting flu and COVID panels last year, and we just were not seeing the prevalence of influenza in our community that we're now seeing this year as attention to mitigation measures has dropped off. Taking a look at our Co-County wellness reports, again, these bars are showing the percent of success of Co-County Wellness's efforts, not the totality of their work. The totality of their work is realized by adding up the numbers. And you can see when you add up the numbers here in the last 2 weeks compared to the 2 weeks prior, they are getting an enormous influx of work to be done. What we're seeing is that the public is not working with them, and their efforts of their work is not being highly successful by percentage of that work. This is both the case here in their case investigations, as well as the follow-on contact tracings that they're able to do from those case investigations. Again, you can see you add the numbers up, they're getting a lot more work to do in the last 2-week period, but the success rate is pretty much flat as far as percentage. We do need to take a look at at CDC vaccine recommendations this week, because there have been some changes that we want to bring to the attention of the public. I've highlighted them here. We've seen now the addition of a third dose of Pfizer for moderately to severely immunocompromised kids, now all the way down to 5. This had previously been the case only for adults, but now we're looking at immunocompromised kids too as needing a third dose to have a full dose of vaccine. Likewise, in our boosters, we saw a change here. We're now seeing the availability of Pfizer boosters after 5 months for kids all the way down to 16, and discussions about that extending down lower. There's already been FDA approval for that, but we're waiting to hear what CDC is going to recommend. And then likewise with Pfizer, for even those over 18, we now have 3 windows for boosting: Janssen at 2 months, Pfizer for 5 months, and Moderna at 6 months. Again, all based on continuously incoming data showing the effectiveness of these various vaccines after periods of time. Want to remind everybody that we have a COVID testing site here outside of DES at 2561 Burnville Road. If you don't catch all this information here in the report, it's always available, doyourpartberks.com. But the information that we want to convey is that that test site is currently committed through the 15th of January, operating Tuesday through Saturday for the time periods that are shown here. Right now, we can say definitively through the 15th of January. Just a reminder to folks, we'd like you to enter off of Van Reed Road following the arrow. Please do not queue out onto the public roadway. We've been able to get some flaggers here that are helping us to manage this, and they will wave you off if the line is backed up due to the public roadway. It's really surges that are inexplainable. I mean, they're not happening at lunchtime or anything like that. Just at various times throughout the day, large numbers of people show up, the line backs up, and then less people show up, and we're able to move that line through. We do want to emphasize one very important thing. We've been allowing folks to queue up in line early, and folks are showing up as early as 8 a.m. for the 10 a.m. opening. But on Friday, tomorrow, due to the expected snow, we want to get the lot cleared one last time right before we open the test site. And as such, we will not be allowing people to queue up early. So please do not come early tomorrow morning. We will not be able to allow you onto the lot, and we will wave you off. If people attempt to queue on the public roadway, we will be forced to ask Burn Police to help us to move those people along, because we don't want to risk public safety impacts on the public roadway. And as always, we want to again remind folks, www.doyourpartberks.com for information about testing or anything else related to COVID. With that, Commissioners, back to you for any questions, or I'm done.
Thank you very much, Brian. I hope any media on our meeting today will definitely get that information out with your weather reports, WFMZ, Reading Eagle, WEEU. Please let the public know, do not show up early for testing at the Van Reed Road DES testing site. I will ask you this, Brian. Obviously, we're not telling them they can't show up until 10 o'clock. Is there a reasonable time? Can we say at 10 minutes till the parking lot will be clear?
Absolutely. We've asked the contractors to do a last pass through the queuing and testing area between 9 and 9:30. So I think reasonably by 9:30, folks should be able to begin queuing up.
So 9:30 is the earliest people can get in line for testing, and the testing opens at 10 a.m. I will tell people the last several days, the site has had to close early because they maxed out their testing capacity. So if you need a test, it's a good place.
Yeah, this is covered on the Do Your Part Berks website, but we are sponsoring this test site in conjunction with State Department of Health. They set the rules, they set the parameters, and they're allocating for us 450 tests a day. So the site is open for the time period indicated or until we consume 450 tests. And I want to mention, because one of the commissioners actually asked about this, so it's not obvious, I want to make it clear. We're trying to do a really good job in making sure that people don't get in line and sit there for an extended period of time only to get to the front and be told we're out of tests. We're actually counting back the line as we start to get to the end, and in essence marking the last car that will consume our last available test. So we are waving people off before they ever get in line when we get to the point of having allocated our last test, if you will.
Thank you. That's also a very good point, Brian. Any comments, questions from my colleagues? Thank you very much.